I spiraled quick. And it's really hard to go back out and drink that way again once you know enough about yourself and about recovery. Like,
Ladies and gentlemen,
you are now about to witness
the journey that is the Lyfe Choyces podcast.
Yeah!
We're getting into mental health right away because I will be honest with you. If I had to grow up with social media, I have this on my hand. You know what the semicolon?
yes.
So semicolon, for anyone out there, we've talked about this before. In the English language, a semicolon is used when a sentence is not finished. In the world of suicide, it's to remind yourself that your story is not ended yet. So definitely something I've thought about many times before in the past. I'm not shy about it. I share it quite often. I have it tattooed on me for that specific reason, so that if anyone is going through a situation mentally and they notice that, they know it's a safe place to talk.
Yeah.
I get kind of choked up about it, but talking about social media, I would not have survived high school. Like, I know if I grew up the exact same way that I did, but had social media, 99% chance I probably would have committed suicide. Childhood was that difficult from the social aspect of growing up. Not so much in the home. There was issues there, but that was just more me and my dad button heads. But the idea of what you deal with mentally as an individual, growing up as a young person, as a teenager, as a young adult, I would not have survived with social media back then. And being that we're talking about mental health right away, you are a licensed therapist.
I am.
What was the reason why you wanted to become a person of therapy?
A lot of reasons. I always had like the empath thing going on. Fascinated by why people do what they do, how things work, what makes people tick. So I graduated with a degree in criminology and a degree in psychology. I loved it. I loved learning. I loved going to class. It was crazy. It was reflected in my GPA when I switched majors that I really liked what I was doing. I had tried a couple other things, philosophy. I bounced around to a few different programs and eventually landed at crim and psych, and I loved it. I graduated during a tough time to be a graduate. It was like after the 2008 crash, and everyone was staying in school. And I always thought that I would have to go through like a whole doctorate program and become a psychologist, and that's not true. You can do a master's program in mental health counseling or social work, and you can become a therapist in just a couple of years.
With that degree, that allows you to take on clients and become a therapist.
Yes. I always knew I wanted to do the individual counseling. We had been through an experience with our family where we were exposed to a family therapy session when I don't remember how old I was, probably like 20 or 21.
And that was because of the alcohol usage in the household?
Yeah, one of my parents had gone to treatment, and so for alcoholism, and so we got like called into this family therapy session. The lady had our family dynamics figured out like
In a second.
in a second. Yeah, she kicked me out because my brother and sister are younger than me. And they were like nervous, like how much can we tell this lady? Do we trust this lady? And so they kept looking at me. Like she would ask them questions, can you answer this for me? And they'd be like,
Look for
Am I allowed to-
confirmation
and
from
so
you
finally-
first,
yeah.
right? Well, and I have to imagine on the little yet more than you would know information I have about your family, it's because you were sort of like the parent, the sort of like the adult in
Yeah.
the situation, because your two younger siblings couldn't exactly always go to the parents for parenting. They would go
Correct.
to you for the parenting, which puts a lot onto your shoulders. So that actually doesn't surprise me that eventually you go down the schooling for therapy to
Yeah.
help others.
It seemed like a natural step, really. Yeah, I remember sitting in that therapy session and she just called it out. She was like, "Can you leave the room? They won't talk to me if you're in here. They're looking at you for permission. And this tells me a lot about you guys." But you're a distraction. Can you leave the room? And so I left, and she talked to my brother and sister. And even then, they were like looking at me walking out the door, like, is this okay that we're staying in here with her? I was like, you're safe. Like, she's good.
Yeah.
But after that, I was like, oh, yeah, that's for me. Like, I want to do what that lady's doing. That particular facility was very small and family oriented. And they communicated with me a lot while one of my parents was there. And so I got like some good exposure to professionals with this degree that were doing really good work and were helpful and supportive and validating and resourceful and giving really good guidance. And so I don't know, my interest was piqued. I ended up having my own encounter with alcoholism and eventually got sober. And so after, doing the work on myself for a couple of years, I went through a 12-step program and had a really incredible sponsor. And I was, ironically enough, bartending at the time. She was like, you can't be a sober bartender forever. I mean, you can if that's what you really want to do, but I know that's not what you really want to do.
So you ended up having an alcohol problem.
I did.
Not shocking, as we know. Part of it is hereditary.
Mm-hmm.
It can be hereditary.
And I had it from both sides.
Right. You had mom and
Mom
dad,
and dad.
both alcoholics. It's what you saw was normal. Like as a child,
Right.
we look at our parents as this is normal.
Yeah.
So growing up, going on into life, being of the age of college, university, bartending, you then all of a sudden realize yourself, hopefully not because too many bad things were happening, but yeah, okay. Boom, I obviously have an alcohol problem.
Yeah.
And I need to get help. Was it a situation where you were like, I need to get help, or was it someone was like, you need to get help?
Oh, I knew I needed help.
Okay.
I knew it. Yeah. I made the call. I could not do it anymore. I was exhausted.
Mm-hmm.
It's such a hard way to live. And people think it's like the easy way out. I mean, it's really hard to get sober, but it's hard to live that way too. It's really hard to be caught up in that cycle, but it feels impossible to get out of it when you're in it,
I do.
And when things got bad enough, my sponsor always used to say, it sounds confusing, so I always have to say it like a couple of times. When the pain from the pain is greater than the pain from the change is when we change. I got it right. When the pain from the pain is greater than the pain from the change is when we change. And the pain was too great from the pain. I was ready to change.
And when you got into the 12-step program and got sober, you still bartended?
I did for
Wow.
like years. I was making really good money,
Yeah.
and it didn't trigger me. It was like a good insurance policy, kind of. You had to deal with intoxicated people all the time. And I was like, oh God, not a good look.
For you, it was almost like a reaffirmment to stay on. Not many people in the program could do
that.
And be around alcohol or around people that do drink, or God forbid, even be in a bar
I wouldn't
without
advise
falling
it.
back.
Yeah,
Right.
I
It's
would
very,
never
very
advise
rare.
it. It's stupid. If you sit at the barber shop long enough, you're going to get a haircut, right?
Yeah,
So like,
absolutely.
it's so ill advised, and that's why my sponsor was very concerned about me finding something else to do. But at the time, I knew, like, I was done. I could have done any job in the world, and I knew I wasn't going to touch the stuff. Like things got so bad for me so quickly. I was so scared.
So
I
you
just knew.
found you put yourself in the 12-step program.
Mm-hmm.
You got
Which
a
I
sponsor.
had good models. So
Right.
after growing up in a house where I had, role models that were setting maybe an atypical example for me growing up with two alcoholics, I then had two parents who got sober as well. And I knew where to go. I knew I could call them and ask for help. And so it's really amazing. Alcoholism is a family disease, but recovery is too. Recovery is a
amazing.
family program. And so it really came full circle when I called my mother and I was like, I can't do this anymore. Can I come to a meeting with you? And I went, I picked up my white chip, and I had already had some exposure to the program at that point. I had actually been sober like a year, and I thought that I was cured. I was really young. I was like 22 the first time I got sober, and I stayed sober for like a year, and I felt like after a year I like graduated. I was like, I'm too young, to really have like a true alcohol problem. I think I was just crazy because I was like young and in college and having a good time, and I could probably, try this again. It took like 3 months, and I ruined my whole life. So,
Really?
yeah, it got really ugly. And they say, that there's all kinds of little sayings and slogans in AA. And one of them is you pick up where you left off, right? Like if you go back out and relapse, you're going to pick up where you left off. And I always thought that was like baloney. Like there's no way.
You were also very young. I mean, you were, like you're saying, you were 22
I think I was 23.
years old.
Yeah, I was 23. And it was just, it was hard. I was looking around at meetings and I loved all the people that I had met. It's such a good community, especially down here. Like in South Florida, we're so lucky to have a really good recovery community. So there's no shortage. You could go to a meeting at any hour of the day, at any time. Somebody's always going to pick up the phone. Like we're really lucky here. But yeah, I just thought there's no way this is like for the rest of my life. I'm okay. I think this really calmed me down, and it did not. I picked up where I left off. I was even worse off than I was the first time. I spiraled quick, and it's really hard to go back out and drink that way again once you know enough about yourself and about recovery. Like a head full of AA and a belly full of booze is like not a good combination.
Mix.
And
No.
so it was always nagging in the back of my mind, like, I think my time is running out with this, and I'm probably going to have to go back to those meetings soon. I could like feel the impending sense of doom coming, and I kind of took for granted that like my seat was always going to be available to me in there, right? Like you just think, well, I'll go back when I'm ready. I know where to go. I know what to do. I'll go back when I'm ready. I almost died trying to get back there, And so that's the part you don't account for, is like the bad things that are going to happen while you wait to go, humble yourself. So, yeah, I had like a near-death experience, and I was totally done after that. I was done. That was
Back
almost
in the program,
13 years ago.
Back in the program, and now you're 13 years free. Just good.
And so I worked really hard like that first year and a half on just the steps, staying sober, developing, building a life that I wouldn't want to throw away. That was my focus.
And after the second time, after the first time of successfully being in the program, second attempt, first time successful, that's where you then went to school and realized, okay, this is amongst the other reasons I want to help people now, whether it's alcohol or other. I want to just help people.
Right.
And I'm going to go to school. I'm going to go get my certification to become a therapist.
I went on a little journey after doing my 12 steps. My sponsor gave me homework to sit down and interview people with jobs that I thought were cool, like people that were doing things that they seemed to enjoy, like people who had jobs that they liked, that were generally happy, successful, maybe had a lifestyle that I liked. Ask them how they did it. Did you have to go to school? What did you have to do? What kind of certifications did you need? How long did it take? Did it cost you a lot of money to have to do that? What do you like about your job? What do you not like about your job? So I interviewed like all these amazing professional women who I was lucky enough that they gave me the time of day I would take them to coffee and I would grill them about their jobs and their education. And in that process, I realized that I knew I really wanted to help people. That was like a given. But I thought I was going to have to do this like 5-year doctorate program to get the degree to be able to do that. And I sat down with someone with a doctorate in psychology, and she was like, if I could go back and do it all over again, I'd go for the master's in social work. You can do everything I can do except for like IQ testing and,
you can't write a script.
Right. Well, I don't think she can either.
Okay.
But they can do like standardized testing for certain like diagnostics and IQ and things like that. And I can't do those things, but I don't want to. I like this part.
You can sit with someone, whether it's online or in person. You can be someone's therapist.
Right.
You can talk them through certain things and help them realize wherein lies maybe the bigger problem, or what they can do to get past that particular train of thought, how to get better mentally.
Yeah.
What do you think is like the biggest stigma? Because forever, I think now a little less, but forever it's always people almost get made fun of if they go through a therapist. I commend people
Yeah.
to go. Like one of my closest friends, for a period of time was going, I think, once a week. Couple of girls I used to work with way back at the beginning when I did all this, they told me that they went. But what do you think is the biggest stigma? What do you think holds people back from actually going and speaking with a therapist?
Oh, gosh, that's a good question. I think I agree with you. I think the stigma used to just be if you go to therapy, like something's really wrong, that it was like, oh, asking for help? No, not me. No, I can handle it. Hard to say. It's changed a lot. Therapy, life coaching, self-help stuff in general, people are like really interested in this like mental health movement that I feel kind of started during COVID, like when everybody was on TikTok a lot and home looking at things all the time. You know what I mean? Like I think everybody really got interested in this. And I think it became more accessible. I was just talking to my husband about this the other day. It became so accessible during COVID because telehealth wasn't really like the standard of practice before, but now it's like hard to find anyone who will see you in person. Everybody loves working from home and everyone loves being seen from home.
But I would prefer, like, and maybe it's just my old school like upbringing. I would prefer to go to an office.
Yes.
I would like to lay on a couch.
Yes.
And I would like to, like, I don't know how it would start because I've never gone to therapy. I'm a very free speaker, so it wouldn't be that hard to get it going. But I don't know what like the normal first interaction would be between a patient and a therapist. But the online thing is absolutely massive. People very much will Google therapy and try to find someone that they can just have a video call with, I guess, which is
There's like, I mean, I'm not even like up on all the technology these days, but I was seeing a client recently and her sister is a therapist in another state. And she was telling me that she does like brief therapeutic phone calls with people. I'm like, I don't know anything about that. She was like, can I just call you and I was like, no, I don't do that. Even this online thing is like, I don't want to say weird. I have a therapist and I see her online, but she doesn't live here anymore. So,
and that's common, yes, for those in the therapy industry.
it should
It's
be.
almost, oh, I thought it was like an almost you have to. If you're a therapist, you need to have a colleague or someone that you go to then because you're dealing
That's
with,
different.
You're receiving a lot. You're receiving a lot of information from other people about their lives.
Yeah.
And you're the one that's you're the sponge. You're the one that they're bouncing everything off of basically.
Yeah.
And then you have to know how to let that go before going home, which is not always easy because you're like, oh man, I could have said that to this person, or, oh, you know what? I could help them by saying, so there's a lot of that. So you need to unload that onto someone. So I would just think that it's a natural must for a therapist to have a therapist.
Initially, it is. Initially, it is a must.
Okay.
In order to get licensed, you need to undergo, they call it clinical supervision, and you have to have like a certain amount of hours that you practice and a certain amount of hours of supervision. So you'll work for like 2 weeks seeing patients, then every other week you see your clinical supervisor and you talk to them about your cases. And sometimes it's somebody who like already works at the place that you're working, like at my it's when you're interning, when you're in school as well, you have a clinical supervisor. So while you're in school and then like for the 2 years after school, it takes you 2 years to get a license. If you do everything on track, it could take
Do the school,
longer.
then another 2 years.
Yeah, but you're working, you're making money at that point.
Okay.
You do everything under the umbrella of like this qualified like you're running everything by this qualified supervisor in order to get their clinical expertise. They have some oversight over the cases that you're working on, the people that you're seeing. They're signing off on your hours, verifying you're getting the work experience, you're getting the supervision experience, and then you submit all that, you take a test, and that's when you get the full license. But once you get the full license, there's no requirement to be, mentored by anybody. I think most people kind of have a proclivity to like stay in touch with their mentor or have somebody that they can do like case consultation with, even if it's just another colleague in your office, like where you can debrief with somebody.
Yeah. I feel like it's a profession that you would need to deflate the balloon every now and again.
Yeah, it's nice to, I mean, again, with all this Zoom stuff going on, you miss out on the interaction. But at places I've worked, we really, relied on one another for ideas and different perspectives. Sometimes, you.
What would be a normal, like, let's say I found you in the phone book or however people do it, and I came to your office. What would be like a normal first encounter for people who have thought about going to therapy but just kind of are apprehensive about what the process might be like? What would me walking into the office, secretary maybe, have a seat, doctor will be with you, or the therapist will be with you momentarily? What's
Yeah, it depends on the office. In private practice, sometimes there's a secretary. Sometimes you're just seeing the therapist. They're a one-man show working at an office space, and they'll come right out and get you. It is typically a 50-minute hour. So a 1-hour session is typically 50 minutes, and then the last 10 minutes is for documentation and like scheduling the next appointment, office administrative stuff. The first session is, I always tell people, it's like kind of speed dating. I have to get to know as much as I can about you in a very short amount of time because I want to help you and I want to get into that part. But I need to learn about you first. And so typically, if you're calling me to make an appointment, something's going on. Whether it's, some kind of mood thing, if you're feeling depressed or anxious, if it's a relational thing, a spouse issue or a family conflict, stress, whatever the presenting problem is, we definitely want to talk about that. Why are you here? Why now? And have you tried this before? Have you tried anything so far in regards to this particular issue? And how long has it been going on? And then we get into your history. How did you grow up? That can be really important if someone's dealing with, look at my example, alcoholism. Well, how did you grow up? Well, I had 2 alcoholic parents. That tells me a lot, right? So we want to get into your background. We want to know about your education, your work history, your family. It's called a biopsychosocial assessment. So we want to assess for biological circumstances, psychological circumstances, and social parameters that we're working with. And that's how we can best kind of collaborate with you to then come up with a treatment plan. And I always like to recap with people and make sure I understand very clearly what they're here to work on. If I've interpreted the information they've given me correctly, I'm pretty collaborative though. That's the most important thing to me is like therapeutic relationship. That's more important than anything. You don't get anywhere without good rapport. And so I tend to be pretty collaborative the whole time, and I want to make sure I really understand where you're coming from, what you're telling me, what's important to you, what your goals are, and then we make your treatment plan together. What do you want to work on? If I could wave a magic wand and you woke up tomorrow and this issue was not an issue for you anymore, what would your life look like? Tell me 3 things that we think we can achieve out of our work together. And then we come up with the little baby steps of how we're going to get there.
And that's all session 1.
Session 1 is definitely the fact finding and, the digging back through the history. I always try to get collaborative about the treatment plan at the end of that first session because I need to make one. Sometimes if like we don't get through that, that much of it, I will go home and come up with a preliminary treatment plan and then come back with it at the next session and say, like, what do you think about this? We can change things, we can tweak things, and then we get into it. And of course, like then your approach from there really depends on what the person is there to work on.
So the first session is a deep dive into kind of the history, but like you said, the three points there to get you the information. And that's why there's a fair bit of like jotting down notes, because you're trying to figure out the reason why they're here, what they want to talk about, what their kind of like goals are of achieving by coming here. And then after that, like I assume some people are just open book.
Typically, if you ask the right one, you don't have to ask many more follow-up questions because then you'll start getting the information you need.
They almost just kind of want to divulge everything to you and almost maybe overshare in such a short period of time, because usually they get, like you said, a 50-minute hour to kind of get off their chest whatever might be going on that day or maybe the past week or month since you've seen them last.
Right. And like initially, I mean, since we're talking about how it's structured, initially you would want to see somebody weekly, at least for like the first month or two, because you are working on that therapeutic relationship, building rapport and alliance, a trust. And that takes time to have the relationship and also the information about whatever the presenting problem is kind of working together. You really want to be working pretty diligently at that for on a weekly basis for the first month or two. And after that, you can kind of scale back to like every other week, once a month. With individual therapy, sometimes it just takes a little longer. And some people enjoy going and will just keep going.
I know myself, because a big reason why I do the podcast is therapy for me, regardless of what the conversation is, whatever the topic might be that week. Having someone in that chair, it's a half hour, it's an hour, it's a period of time that I get to have this social interaction with someone of a mindset that we're conversating about what I consider good topics, not the normal bullshit that people talk about in like a bar. It's actual conversation. So I find it very therapeutic because I learn things, I share things. I could see myself that once I go to a therapist, because I've said this many times before, I would love to understand on a higher level why this is the way it is. And that's only going to come from, I can assume things based on my childhood, my adulthood, and so on and so forth, but I don't have the knowledge from the actual books to dissect what all that actually means and where I could switch things to let go of, overcome. So I could see myself as an individual that once I found a therapist, I'd be like once a week at least. If I had the financial ability, I'd be like 3 times a week. I'd be like, yo, doc, you available this afternoon? I'd love to swing by for an hour. Like, that's just like, I see this on like TV shows where those who have money, they have their therapist on speed dial.
Yeah.
And the therapist almost has to be like, yo, I just saw you yesterday, but like, there's a lot that goes on in a day. There's a lot that goes on in here for all of us. And I think the mental health industry is phenomenal. I think the mental health awareness community is getting so much bigger, which I'm very grateful for because that's what I'm here for. What would you define mental health as?
Oh, that's really tough. Good question. Mental health, I think, would be a feeling of general contentment amongst your biopsychosocial circumstances, ability to function in everyday life in a way that you feel good about, where there's not something that's, crippling you or holding you back in your everyday life. I think that's really important. This feeling of being able to show up in spite of your circumstances.
In spite of your circumstances, in spite of your environment, it's showing up because certain tasks need to get done for your ability to just live.
When I say biopsychosocial, that's what we're looking at. Big picture stuff, like all these different domains in your life. And do you feel content and a sense of balance? That to me, like that would be my definition of like mental health, mental wellness.
Right.
It's achieving some homeostasis there.
I love the words you're using because they've come up recently in my studies. So I'm totally on the same page with you right now. People really throw around like the psychobabble, meaning using words that they don't actually know how to put them in context, right? And that comes full circle to the way we began the conversation is with the social media, is that there is so much information out there, which I do enjoy, such as this podcast and other short form content where people are learning why it's important to be mentally healthy for yourself, but then they throw around these, red flag, green flag, toxic, poisonous. They throw all this stuff around because they think it's trendy, so they use it.
Right, these are buzzwords.
Yeah, instead of using it or learning or picking up a book to educate yourself so you know how to use it in the proper context. I do many things in a day because I believe for myself there's certain things I need to do every day to stay mentally healthy. I ask, I pray, and I act on the things I believe I need to do to live a mentally healthy life. I'm functioning because, like you said, and I've expressed this many times, when I feel low energy, when I feel depressed. It's going to happen the rest of my life. I'm a human being.
Yeah.
When I notice that these massive feelings, emotions happen, I allow myself to feel them because I'm aware of being grateful for having those as much as having the happy ones.
Yeah.
And when I feel depressed, or if I feel for a couple of days I'm a bit low energy, something's wrong, or I have this overwhelming desire to cry, I find that movie that will do that for me, and I slot in. You'll see the whiteboard. I'm a bit too organized, I guess, and I don't hit everything every day, but I write things down. And I will say, okay, tomorrow I'm going to have 2 hours. I'm going to put that movie on. I'm going to lay there and I'm going to cry. I'm going to allow that emotion to come in and literally funnel itself out of me. And I will go back to my life because
Right.
I know that it's okay to feel like that at times and appreciate that feeling. Those are my practices. What are maybe 2 or 3 mental health practices that you might suggest for people to live the daily life?
So I love yours, and I think people could generalize that in other ways. Yours is really effective because it's something you know is going to evoke emotion that's stirring, that needs to come out somehow, right? Like it needs an outlet. But you find a way to put a cap on it so that you don't drown. With people who have like really severe anxiety, for instance, trouble falling asleep at night because their mind is just racing, I'll tell them, like, keep a notepad by the bed and write down all the racing thoughts that you're like all the things you're worried about not getting done tomorrow, next week, whatever, all the worries that are floating around, write them down, leave the notepad on the nightstand, and now you have your to-do list for tomorrow. And it makes you feel like you're doing something. Writing things down feels productive because it feels like you're doing something about it. You're getting it out of your head and putting it onto a piece of paper. You haven't addressed the actual worry that's on the paper, but you've done something. You've moved a muscle and gotten the thought out, and you put it on a list, and now you might be able to fall asleep. I know it sounds so simple and like reductive, but a lot of the best suggestions really are. A lot of the suggestions would be very person dependent, but like yours is great because it has a start and a finish. A lot of times that's, I think, where people with particularly depression, anxiety can get into trouble is like cutting it off. Anxiety, again, another suggestion I would give is like designated worry time. Set an alarm or like a timer on your phone and allow yourself to worry about everything for like 8 minutes. Run yourself into a tailspin. As long as you know some good coping strategies and like relaxation techniques for after, we work on that first before we let you do this. Know a few deep breathing techniques, know how to calm yourself down, but allow yourself to just totally bug out for like 8 minutes. And then when the timer goes off, you're done. No more.
I love that.
We're not thinking about it, and you have to have something planned for right after. We're going to go do something else now. What's something you like? What's a place that makes you happy? Who's a person that will make you feel better if you talk to them, right? And you're going to go do that thing now instead. And again, a lot of this sounds really oversimplified, but
it's not, though. That's what I try to express to people, and I don't have any background in the studies that you have, but I've learned from the multiple books around us here for what works for me. A lot of them seem like when you tell people what you do on a daily basis to keep yourself going or to keep yourself happy or to keep yourself motivated, disciplined, all the aspects that you want to be, it really is the simplest things. Like everyone in our community knows my daily routine, knows the 30 minutes I spend in the morning with my chief aim, my prayers, my gratitude list, my affirmations. I have 3 books that I write in every morning.
That's awesome.
Those same 3 books get written in before bed because I do that kind of like finishing off the day thing where I don't necessarily have a hard time falling asleep anymore because for me, routine is important.
Yeah.
So try to get up at the same time, go to bed at the same time. Fill my day with mental and physical activities so that when it comes down to that hour before bed, I'm ready. Like I am good to like I give myself 15 minutes now, and within those 15 minutes, more times than not, I'm asleep.
You're out. Yeah.
Yeah. And I write things down for my intentions for the next day. Like I said, all these little simple things that people would be like, really? Yeah. But all of them for me.
It adds up. They're drops in the bucket.
Yes. And
They're
day
drops in
after
the
day
bucket.
after day. Absolutely.
And that's so important. I talk to my brother about this all the time too, is like motivation's really nice, but discipline's better. And so like, even when you don't feel like it, like in spite of whatever kind of day you've had, you're writing in those books. That's a discipline. That's a practice that you've cultivated. And it sends a signal to your brain, like my day is complete when I engage in this activity, and then it's time for me to go to bed. Having some kind of practice that's like a winding down is really good for your brain. And again, your brain doesn't know the difference between reality and something you've just thought about. How many times have we sent ourselves into a tailspin because of something we thought about?
That's a whole other topic for a whole other day because we are running out of time. I know you need to go and pick up your children. I want to dive even more so into this on all these topics about therapy because it's a huge thing in my life that I think is important to share with people so that they could also. I'm a big fan of what can we do to help other people live physically and mentally healthier.
Yeah.
And that's a big thing. And you're definitely going to help our community grow because all your experiences that I didn't even know we were going to talk about ended up being an episode.
Thank you for having me.
My absolute pleasure. For everyone out there in our community, I want to thank you once again for coming back each and every week. We'll see you next Tuesday at 2 p.m. here on the Lyfe Choyces podcast. Much love, everybody.
You are now about
The Journey, Life Choices podcast.